Welcome everyone to an in-depth look at Ethambutol-induced optic neuropathy, a serious eye condition linked to the use of the medication Ethambutol. We'll explore what causes this condition, how it affects the eyes, and what can be done to manage and prevent it. Join us as we unravel the complexities of this often overlooked side effect. Ethambutol-induced optic neuropathy, as the name suggests, is caused by the medication Ethambutol. This drug is a crucial component in the treatment of tuberculosis, or TB, and other mycobacterial infections. While effective against these infections, Ethambutol can unfortunately have toxic effects on the optic nerve, the vital pathway that carries visual information from the eye to the brain. The exact mechanism by which Ethambutol damages the optic nerve is still being researched, but factors like dosage, duration of treatment, and individual susceptibility play significant roles. The pathophysiology of Ethambutol-induced optic neuropathy is complex. Ethambutol is believed to disrupt mitochondrial function within the retinal ganglion cells and nerve fibers of the optic nerve. Mitochondria are the powerhouses of cells, and their dysfunction can lead to cell death. This disruption leads to impaired axonal transport, meaning that essential molecules can't be efficiently transported along the optic nerve fibers. Over time, this damage can result in the degeneration of the optic nerve, leading to visual impairment. Estimating the exact prevalence of Ethambutol-induced optic neuropathy is challenging. Reported incidence rates vary widely in different studies, ranging from less than 1% to as high as 6%, depending on factors like dosage, duration of treatment, and patient-specific risk factors. Individuals with pre-existing optic nerve conditions, renal impairment which affects drug elimination, and those on higher doses of Ethambutol are at a greater risk of developing this complication. Because TB is more common in certain populations, Ethambutol-induced optic neuropathy is also disproportionately seen in those communities. The signs and symptoms of Ethambutol-induced optic neuropathy can be subtle at first, often developing gradually over weeks or months. Common symptoms include decreased visual acuity, meaning difficulty seeing clearly, color vision deficits, particularly an inability to distinguish between red and green, and visual field defects or blind spots in your vision. Patients may also experience blurred vision, or even eye pain, although pain is less common. It's crucial to report any changes in vision to your doctor immediately if you are taking Ethambutol. Diagnosing Ethambutol-induced optic neuropathy relies on a comprehensive eye examination. This includes assessing visual acuity, testing color vision using Ishihara plates or similar tests, and evaluating visual fields using perimetry. An ophthalmologist will also examine the optic nerve head for any signs of swelling or pallor. Optical coherence tomography, or OCT, is often used to measure the thickness of the retinal nerve fiber layer, which can show thinning in affected individuals. Additionally, visual evoked potentials, or VIP, can assess the electrical activity of the optic nerve in response to visual stimuli, helping to confirm optic nerve dysfunction. A thorough medical history, including Ethambutol dosage and duration of treatment, is also essential. While Ethambutol-induced optic neuropathy doesn't have specific subtypes, it can be classified based on the severity and the pattern of visual field loss. Some individuals experience mild visual disturbances, while others may suffer from significant and permanent vision loss. The pattern of visual field loss can vary, but often affects the central field of vision, impacting activities like reading and driving. The primary treatment for Ethambutol-induced optic neuropathy is immediate discontinuation of the medication. In some cases, vision may improve after stopping Ethambutol, but the extent of recovery varies. Supportive therapies may include nutritional supplements and antioxidant vitamins, although their effectiveness is not definitively proven. Regular monitoring by an ophthalmologist is crucial to track any changes in vision and to provide ongoing support and management. Low vision aids can be helpful for those with persistent visual impairment. There is some evidence suggesting that corticosteroids and other neuroprotective agents may be beneficial. However, more research is needed. Prevention is key when it comes to Ethambutol-induced optic neuropathy. Baseline eye examinations, including visual acuity, color vision testing, and visual field assessments, should be performed before starting Ethambutol treatment. Regular monitoring throughout the treatment course is vital, ideally every month or two. It's also crucial to use the lowest effective dose of Ethambutol and to adjust the dosage based on kidney function. Patients should be educated about the potential visual side effects and advised to report any changes in vision immediately. Close collaboration between the prescribing physician and ophthalmologist is essential for optimal patient care. The prognosis for Ethambutol-induced optic neuropathy varies. In some cases, vision may recover partially or completely after discontinuing the medication. However, in others, permanent vision loss may occur, particularly if the condition is not diagnosed and treated promptly. Recent research is focusing on understanding the mechanisms of ethambutol toxicity and identifying biomarkers that can predict individual susceptibility. Studies are also exploring potential neuroprotective strategies to prevent or mitigate optic nerve damage. These advances offer hope for improved outcomes and a better quality of life for individuals affected by this condition. Ongoing research continues to improve our understanding and management of this challenging complication.